As a board-certified personal injury lawyer that handles medical malpractice cases, I've seen firsthand how life-altering cerebral palsy can be for a family and the lifelong challenges that victims have to endure. Hello, I'm Matt Powell, and in this video, we're going to explore medical malpractice incidents that lead to cerebral palsy to learn how we can take action if your child has developed this condition. So what is cerebral palsy? Cerebral palsy, or CP, is a neurological condition caused by damage to the child's brain during childbirth. When the baby can't get oxygen for long enough time, brain cells begin to die. This affects a child's movements, muscle tone, and motor skills, as well as their cognitive abilities, all caused by the lack of oxygen during childbirth. Cutting off a child's access to breathe causes brain cells to die, which leads to varying degrees of motor impairment, including difficulty walking, poor coordination, and muscle stiffness. Children with cerebral palsy may experience cognitive or developmental challenges, and the severity of CP can range from mild to severe. Since cerebral palsy develops during labor, during the delivery of the baby, or shortly after birth, most times the parents are not told what happened, and many families are left wondering what went wrong. Was it something that developed throughout the pregnancy? Did something go wrong during the labor or the delivery of the baby? Or did something happen after the birth of the baby? Or is it just God's plan? While in some rare cases, cerebral palsy develops from natural causes. In many cases, hospital negligence was the cause of the child's lack of oxygen. This is why it's important for families to be aware of the connection between medical malpractice and cerebral palsy. Sadly, the symptoms of cerebral palsy may take a few years to become apparent to the parents of the injured child. Let's go over 5 common causes of cerebral palsy that are linked to medical malpractice that families should be aware of. 1. The failure to monitor fetal distress. This happens when medical professionals fail to address signs of oxygen deprivation during labor and delivery. 2. Delayed C-sections. This happens when medical professionals wait too long to perform a cesarean section despite indications of complications. 3. Improper use of delivery tools. This happens when medical professionals' misuse of forceps or vacuum extractors causes injuries to the baby's head or brain. 4. Failure to treat maternal infections. Untreated maternal infections, such as a urinary tract infection, may cause an effect to the baby's brain development. And number 5, errors in neonatal care. This happens when the medical professionals fail to treat conditions like severe jaundice or low blood sugar, which can lead to brain damage. So here's some potential red flags parents need to be aware of that may indicate medical malpractice was involved. Unexpected complications during labor or delivery, failure to address signs of fetal distress, delayed response to emergencies during childbirth, and the lack of prenatal or postnatal care. If you suspect you or your child had a difficult delivery, do not wait. Call an experienced board-certified civil trial lawyer at once to discuss your concerns. The law has strict time limits on when a claim can be brought. If any doctor or healthcare provider has suggested that your child may have suffered damages caused by a difficult delivery, the time clock to bring a claim may have started ticking already, and your 2 years may pass before you ever see signs of cerebral palsy in your child. The time limits are complicated, and you should consult with an experienced lawyer right now if you suspect a child has a cerebral palsy condition caused by medical malpractice. Thank you for watching, and if you have more questions, please subscribe and watch my other videos that help explain your rights if you have a question regarding a legal personal injury matter. Don't forget, just call me, Matt Powell, 813-222-2222.